Hello, my name is Jay Erie, and this morning I have the distinct pleasure of speaking with Dr. Doug Koch, President of the American Ophthalmological Society, the AOS. Doug, when I joined the AOS a few years ago, I found out that the AOS annual meeting became my favorite meeting of the year. Can you tell us a little bit about the AOS and what it is about the AOS that makes it such a unique organization?
The AOS is really an amazing organization. It's the oldest medical organization still continuously functioning. It was founded in 1864, and you might scratch your head and think, did something that started in 1864 does it still have relevance? Is it still useful? AOS comprises people who are selected, asked to join, they write a thesis, and as such, it's a highly selective organization of some of the most wonderful minds and most interesting people in our field in all subspecialties. And when we get together for a meeting, we have this unique group of people who share their expertise with everybody. And so there's this sort of cross-subspecialty fertilization of ideas, lots of discussion. And I think all of us go back to our own homes, our offices, our departments, feeling that we've learned not only things in our own subspecialty, but really broaden our knowledge of ophthalmology. There's another really unique feature of it is that it's small, and so we can get together in a think tank-like way often and do things that you can't do in other settings. You can do white papers on healthcare reform or on ethics or on the ophthalmologists of the future, which is what's the next one is coming. We can have symposia on nanotechnology and genetics, things that might affect most, if not all, of the subspecialties, and we can kind of share these ideas. So I think AOS is actually becoming more relevant than ever. We live in an ophthalmic world where people are getting more and more segmented into subspecialties, and this is a way to bring some of the real leaders in our society, in our ophthalmological society, together in a meaningful way.
That's great. Doug, today starts off the cornea subspecialty pre-meeting at the American Academy of Ophthalmology. There's a lot of great talks today. You're leaving for one soon, in a few minutes. What do you think is the most exciting development in the past year in your subspecialty?
I think if I look back at the last year and I see how my world has changed and how my practice has changed, I realize that I have become as much a patient counselor as I have a surgeon. That with the array of choices we have for patients undergoing cataract surgery and refractive surgery, we need to spend more and more time educating our patients and helping them select the optical result that might be optimal for them. And then we have to match all of that with our technology. We have to hit the intraocular lens power, we have to do perfect surgery. So everything is moving toward perfection, toward customization. And we have to remember, who are we talking about here? We're talking about the baby boomers, and they're used to having it all, they expect it all, and we have to deliver it. And it's exciting to try to tackle that issue and provide absolutely the best care in a personal way to this growing population of patients.
Doug, thank you very much. Speaking for the members of the AOS, we feel very fortunate to have you as our president this year.
Thank you, Jay.
Thank you again.
All right, thanks.